There. For those of you who don't know my name, I'm Dr. Kevin Cope, and I am one of the medical directors of Lexington ARC. And I want to talk to you today about the COVID-19 vaccine. Many people are asking me a lot of questions about this, and there's a lot of confusion out there. There's a lot of anxiety. There's some people that are saying they're scared to get it. And there's also many happy people out there thinking, I want this vaccine as soon as possible. So their emotions are all over the place on this one. So I wanted to give you some educated information so that to help you make your own decision about this vaccine. And I want to tell you first off that I have looked at all the information about this vaccine that I'm going to explain to you today, and I am choosing to get this COVID vaccine. And I'm going to explain why I'm choosing to get the vaccine and why I think you should strongly consider getting it too. I also have two younger daughters in the healthcare field, and they are both planning to get this vaccine, and we're all planning to get this vaccine in the next several days. We are actually signed up to get it. So we're going to start off with how it works, and then we're going to talk a little bit about how effective it is. We're going to talk about some of the side effects to expect from this vaccine. And then we're going to talk about why I think the benefit outweighs the slight risks involved with this vaccine. So how does this COVID vaccine work? Well, any vaccine works by training your immune system to recognize a germ, such as a virus, and be able to fight it off quickly if it comes into your body. And it will keep you from getting the infection. So that's how any vaccine works, and the COVID vaccine is similar to other vaccines. Well, this vaccine is a little different from other vaccines, and I'm going to explain to you why now. Many of you have seen microscopic pictures or drawings of the SARS-CoV-2 vaccine. It's this little nasty looking particle with these little, usually the red spikes sticking out of it all over. You've seen that in pictures and drawings. Well, those little spikes are called spike proteins. And the COVID vaccine uses a technology called messenger RNA technology to actually synthesize those spike proteins in your cells. Now, those spike proteins cannot hurt you. They contain no virus, but having those spike proteins in your body triggers an immune response. And it triggers that without actually putting the virus in your system. So I want to emphasize that this vaccine contains no virus. There is no chance of getting COVID-19 from this vaccine. What it does is it stimulates your body to produce these spike proteins so that if you are ever exposed to the virus, your body knows immediately to ramp up your system, produce antibodies, and keep the virus from infecting you. So that's how it works. And there's been a lot in the news about this messenger RNA technology, as this is the first time it is being used in a vaccine. But let me tell you a little bit about that. This technology is not new. It's been around for more than a decade, and we were able to employ it to quickly produce a lot of this vaccine in the laboratory. As I mentioned, these messenger RNA vaccines do not contain any live virus, so there is no risk of getting COVID-19 from the vaccine. And also, I want to mention that the messenger RNA vaccine does not affect your DNA. I know there's been a lot circulating on social media and on the fake news sites that it can affect your DNA. But if you remember biology class, your DNA actually lives in the center or nucleus of your cell. The messenger RNA does not enter that nucleus and does not affect your DNA at all. So I want to put your mind at ease on that one. So how effective is this vaccine? because it's one thing to have a vaccine, but does it work? Well, 6 days ago in the New England Journal of Medicine, which is the world's leading medical journal and only publishes the very best of the best of research done, they had the article about the Pfizer COVID-19 vaccine, and they had the summary of how effective it works. And there was a final analysis done of phase 3, which is the final phase of testing for a vaccine. They immunized more than 43,000 volunteers with either the vaccine or a placebo. They either got like a saltwater injection or they got the vaccine. Patients didn't know which one they got. The researchers didn't know which one they got. What they found out of those 43,000 people were that 170 of them developed COVID-19. But when they broke the code, they found that 162 of those people had gotten a placebo and did not get the vaccine. And of the people that got the vaccine, only 8 people got the COVID-19 infection from the community. Again, not from the vaccine, but they picked it up in the community. This is tremendously effective. It's one of the best trials we've ever seen with vaccines, and over 20 times the number of people got COVID infection if you did not get the vaccine. So this is truly a remarkable study. They did find the vaccine works most effective if you get 2 doses 3 weeks apart, injected in the muscle in your upper arm, just like when you get a flu vaccine. So they are recommending 2 doses, and that will be our recommendation. They also found that this vaccine works across all ages, genders, racial groups, and even other countries. They've also shown it to be effective. They've studied it so far, this Pfizer vaccine that's coming out first for ages 16 and up. That was how the study was done. So that is who is being recommended to get this particular vaccine. You have to be 16 or over. Well, it's one thing to know how it works. It's one thing to see if it's effective, but is it safe? Because we're putting something into our body, we want to make sure it's safe. And believe me, I reviewed this very closely since, like I said, I'm signed up to get the vaccine myself in 2 days. What we did is we looked at the side effects of this vaccine in the research article of these thousands and thousands of people that have gotten this vaccine. So some of the side effects to expect that they've seen is some mild muscle aches, some slight fatigue, perhaps a slight headache, perhaps a low-grade fever. But they're all mild side effects, and they are not the COVID-19 infection. In fact, these side effects actually show that your body is developing a good immune response to the vaccine, and it's actually a good sign that the vaccine's working if you get these side effects. So they're nothing to worry about. They last for a couple of days and they go away. Again, I want to repeat, because I hear this over and over again with vaccines, you cannot get COVID-19 from this vaccine. It is scientifically impossible. So the FDA looked at the data and they did give this emergency approval because of the pandemic. They feel it's quite safe. And there's already been about 70,000 people that have been in trials with the COVID-19 vaccine. Some people ask me, will this give me lifelong immunity? We don't know that yet, but it seems to generate a quite strong immune response in your body. So we'll be studying that, whether you might need a booster a year or 2 or 4 or 5 years from now. We don't know that information yet. It's too new. Some people ask me, well, how were we able to develop this vaccine so quickly? Did we cut corners on the research? How were we able to get this out so quickly? Well, there's something, and you probably have heard it mentioned, it's called Operation Warp Speed with this vaccine. So what we did with this vaccine was we overlapped steps of the production of the vaccine so that we could do this very quickly. For example, while we were in phase 1, 2, and phase 3 trials, the companies were already manufacturing millions of doses of this vaccine. Our government told the companies there would be no risk to them if they manufactured the vaccine ahead of time. Now that we're ready to go, we actually have millions of doses of this vaccine ready to start to give that out. But what about rare, serious side effects? I think that's important to look at. So, in terms of rare, serious side effects, there were 4 people out of thousands of people given this vaccine who developed what they call a Bell's palsy. So, a Bell's palsy is a temporary condition of muscle weakness on one side of your face caused by inflammation of the facial nerve. It usually clears in a few weeks to months. We see patients in our office with a Bell's palsy. It can be caused by other conditions as well. And honestly, what we do with a Bell's palsy is we usually let it run its course. We give you some eye drops so that your eye doesn't become dried out and you're able to work, you're able to function. And after a few weeks to months, it completely resolves. Although it's something that's concerning, there was only 4 people out of thousands and thousands that developed that. So we're not even 100% sure that those 4 people may have just developed it coincidentally, but it's something we have to report on. But it's something that's very treatable, resolves without any kind of serious problem. The other side effect that we need to watch for is a very, very rare side effect called anaphylaxis. So anaphylaxis can take place from putting almost anything into your body, and that's why some people can't take penicillin. When they swallow it, it causes an anaphylactic reaction. It's very rare, but because of the possibility and the fact that this is a new vaccine, what we are recommending is after you receive the vaccine and after I receive the vaccine in 2 days, I will be watched for 30 minutes and to make sure I don't develop any kind of serious anaphylactic reaction. If I do start having any kind of serious reaction, they will immediately treat me with medication, with epinephrine, and it's a very treatable condition. So we are recommending that anybody who has this vaccine be watched for 30 minutes after to make sure they're okay. So far, I think I've seen in the media as they've started distributing this vaccine, just 1 case of an anaphylactic reaction. So it's very, very rare. Another question people ask me is, what about children? What about pregnant women? What about breastfeeding moms? So this vaccine is approved for age 16 and over. There are some other vaccines coming out soon that have been studied at a slightly younger age, but for this particular vaccine, you have to be age 16 and over. As far as pregnancy and breastfeeding goes, they believe that this is a decision you need to make with your healthcare provider, but generally they're recommending you get this vaccine because pregnant moms can get very sick from a COVID-19 infection. So it generally is recommended. Well, some people ask me, they say, why should I bother getting this vaccine when most people just have mild symptoms? Some people have no symptoms at all. So let me ask you today, are you willing to roll the dice that you or one of your family members or friends or coworkers or people you help provide care for don't get very sick and be hospitalized and perhaps end up on a ventilator and perhaps even pass on for this virus, especially people at high risk. And we all have those people in our families, then we don't want to bring the virus home to. So that is a major reason why I am getting this vaccine for the people I come in contact with. I don't want to transmit infection, the COVID-19 infection. I want to be immunized and protected so I can't pass this COVID-19 infection on. Another major benefit I want to talk to you about, if enough of us get this vaccine, is there's something we call herd immunity. Herd immunity means that when enough people are immune to COVID-19 in the community, we no longer need to worry about it spreading. And we don't need to shut things down, and we can freely open our schools, our businesses, our churches, without worry, because we have herd immunity and enough people are immune to this to keep it from spreading. So this vaccine is not mandatory, and I think you need to make an educated decision. We all live in a free society. We have to decide for ourselves, and you have to make your own decision. But I do encourage you to look at the facts that I've talked about. Don't rely on fake news sites. Don't rely on social media, because a lot of the information is incorrect. As I mentioned, I'm getting the vaccine, my family's getting the vaccine, my two daughters are getting the vaccine. The other thing I was going to mention is that right now there are thousands of healthcare workers getting this vaccine every day. So we are closely monitoring the situation. And believe me, healthcare workers are monitoring their themselves to make sure they don't have any side effects. And so by the time you have an option to get this vaccine, there will have been thousands and thousands of healthcare workers that have had this vaccine. So I encourage you strongly to think about getting this vaccine. Closing, I want to thank you for entrusting us to take care of your loved ones. These past 9 months have been unlike anything we have ever seen before, and we could not be doing this without your support. Together, we're going to get through this. Thanks for your attention today, and have a great, blessed day and a happy, healthy new year. Thank you.